served as Chief Operations Officer of AMAAD and Manager of Prevention and Care with the Black AIDS Institute. He served as the first Director of Diversity, Equity, and Inclusion for the Los Angeles LGBT Center, and he's led work with the African American Infant and Maternal Mortality Initiative, serves as co-chair of the Black Caucus of the Los Angeles Commission on HIV. And man, you got a lot of jobs. He is also the first African American to lead LA Pride. Gerald Garth, nice to meet you.
Yes, so glad to be here, Dominique. Thank you.
And if you want to meet him on YouTube, we got that going on too. YouTube.com, KBLA 1580. So that seems not surprising, but, interesting that
Sure.
you're the first Black person to lead LA Pride. Tell me how that happened and what it means to you.
Sure, yes. And so, again, really glad to be here. Serving as the first Black man, just to add that. But yeah, over the history of the organization and its 50 years, specifically recognizing the necessary need to elevate voices that represent community, I'm really grateful to be able to move the work in a way that really represents LA more broadly.
Yeah, well, I mean, we just finished South LA Pride, and it seemed like there's a lot more prides than there used to be, right? There's
Sure.
South LA Pride, and then there's Hollywood Pride and West Hollywood Pride, and
Yeah, there's prides all over. And I think one thing that really sort of elevates that is that, for one, pride should be available and accessible to everyone. And there are
okay.
so many different experiences of what it means to be proud, specifically as it relates to geography and demographics and interests. And so I think it actually serves the community well to have more opportunities to celebrate.
Yeah, well, I, spoke to folks that I didn't get to go to South LA Pride this year because it coincided with Black Lives Matter turns
Hmm.
10. But I went to it last year, and I've talked to people that have gone to this Hollywood and West Hollywood, and, they enjoyed it.
Sure, yeah. And so South LA Pride is very exciting, and I celebrate that team and the great work that they're doing. And I think it's really important that we look at the intersectional opportunities of Pride. And so South LA Pride is really pride and unapologetically Black in a way that I think is really necessary for the work. And of course, there are other prides that might be considered more mainstream, and there's still time for us all, opportunities for us all to bring our whole selves into the space.
I'm smiling because it's, in my lifetime, the fact that any pride can be mainstream is still remarkable, right?
Yeah, that says just how much progress has been made. And of course, it still amplifies how much more work there is to do. I say often that Pride began as a protest, and so we should certainly be reminded of that. And then now, I dare say more than ever, at least in modern times, it's really important that we're showing up and really vocal and active on what it is for equity for us all.
You know, I yeah, I mean, I have a long journey with this. I'm not going to go into all that. When I first moved to LA, I didn't know LA. I put my hand in the middle of the map and it landed on West Hollywood. I
Mhm.
thought that was the middle. So I got an apartment there.
Mhm.
I didn't even know it was a
Yeah.
gay neighborhood. I figured it out pretty quickly. But I also was surprised because the LGBTQ plus community here in Southern California is really different than what I was used to growing up in the Bay Area, and it felt a lot more segregated.
Sure.
In West Hollywood, when I moved there, I didn't feel welcome.
Hmm.
Not because I wasn't gay, but because I wasn't white.
Hmm.
And so those politics of, racial, ethnic, whatever you want to call it, nationality politics, they do play out in the LGBTQ plus community as well, don't they?
They certainly do, and so racism is certainly still a part of the experience altogether. And I mean, you said it so well as how we look at certain types of inequities, even within certain groups that might call themselves marginalized. And so, part of the work that I do and we do in at Ahmad and beyond really looks at how we're addressing racism and LGBTQ plus spaces, as well as homophobia and other types of disparities within Black spaces. And so, folks have a really a unique intersection when they have multiple identities that uh, lead them.
And talk to me about Ahmad. You're still executive director of Arming Minorities Against Addiction and
And disease,
Disease
yes.
Institute.
Yes.
I mean, there's a lot of stereotypes. There's stereotypes that, black people were at the forefront of every single disease, maybe a true stereotype. And then we always affiliate AIDS and HIV with LGBTQ plus folks, but these are areas that you're working on. So talk to me about how you navigate that, deal with the actual crisis without playing into sort of debilitating stereotypes of us.
Sure. So the work that we're doing at Ahmad looks at exactly that. And so much of the work is really centered around community education to address stereotypes, undereducation myths, and so forth. And the data does show, unfortunately, that black folks do still carry the burden of many health disparities, including HIV, including substance use and abuse, and housing and homelessness as well. And so the work that we're doing at Ahmad is looking at how do we center care and programs in a way that's culturally affirming, but also really driven around outcomes. One thing that we really lead with at Ahmad is whole person care. And so recognizing folks might show up or present with one sort of primary disparity, but recognizing that it's necessary to look at a whole person's needs in order to respond to their health. So, for example, if an individual is experiencing food insecurity as well as homelessness, it would be necessary to address that food insecurity as well as looking at housing solutions as well. So our team does a great job of looking at, again, a whole person approach to wellness as well as retention and services.
You're talking about a whole person approach, and you mentioned houselessness. There's a new report out where it really breaks down the reasons for houselessness in California, and there is a lot in there about substance abuse, which is one
Sure.
of the things you deal with. So I'm interested in this intersection, right, that you're dealing with. LGBTQ plus folks struggling with drug addiction,
Right.
and the high number of black folks that are unsheltered, and then we add on to that this issue of drug addiction. Are you even do you have numbers that track where how many LGBTQ plus folks are being affected, and how are you dealing with these layering of challenging conditions?
Sure. And I'd even add to that list as well that we see disproportionate impacts is with mental illness and mental
Yeah.
health concerns. And so, to your question, certainly looking at key points of entry into care and service. And so, we work very closely and have a number of programs that look at reentry and justice involvement programs. Being able to connect with folks upon release is a strong way in which we're able to engage folks and really connect them in real time in a way that serves their needs in that way. And also, yes, looking at multiple data sets and those intersections, we're recognizing too that there has not been as much robust data that looks at those intersections. And so having now efforts that look very specifically at those needs also helps drive the work also. And yeah, just again, I say this often as a part of a care plan, looking at ways to include people in their care plan again, even what I say, ensure that folks are in the driver's seat of their own care. So a lot of times folks are sort of being shuffled around and not really an active participant in their wellness. And so our approaches really look at strength-based approaches also.
I remember the case of Ed Buck, right?
Hmm.
And a lot of the victims of Ed Buck were people who were unhoused
Hmm.
and gay,
Hmm.
LGBTQ
Sure.
plus,
Hmm.
same gender loving,
Right.
whatever term we're using, and also in drug addicted
Hmm. And black.
and black.
Yeah.
Do you have numbers? Do you have a sense of how this unhoused person's crisis is hitting black gay folks?
Yes, and so looking at, as you mentioned, the spectrum of the LGBTQ plus experience, at those each of those letters within the umbrella have very unique needs and challenges. So when we look at the impacts on women and women identified folks versus young folks versus trans identified folks, those are all very unique communities that have very unique needs. And so there is still a great deal of work to be done to look more specifically at those intersectional needs. We do know, of course, as we've shared a few times already, that black people are disproportionately impacted, but the data is still moving in the sense of how we're able to respond to the intersectional communities within the LGBTQ plus identities.
Yeah, and we've seen data recently also that women,
Right.
across the board, elders, well, that
Yeah.
would be the
The
L,
L.
right? um, and cisgender women
Yes. Young women.
are
Yeah.
disproportionately impacted by houselessness.
Yes. Houselessness, and again, that is exacerbated again at those intersections when we look at mental health needs, and even what the term is around survival strategies. And so, like, there's a lot of elements that look at exchange sex, or different types of survival methods. And so, yes, women are disproportionately impacted, and the data, like you mentioned, is much more intentional, looking at women's needs in a way that it has not historically. And so that gives us an opportunity to respond more intentionally. But it is unfortunate because within those data sets, at each of those subcommunities, Black women are disproportionately represented.
I can only imagine what the numbers for Black trans women look like.
Yeah, and it is again just unfortunate when we see not only the experiences of individuals, but when we look at legislation and policy, and then just societal experiences that really, again, just further burdens the challenges of those individuals.
But what I was referring to was the UCSF Benioff Homelessness and Housing Initiative study that came out recently, and just unpacking, some of the stuff that I've mentioned is based on those numbers and that data, which seems to show these disproportionate impacts
Sure.
that I've been highlighting. So what are you doing about it at Ahmad? What's your approach? We've only got a couple minutes here, but we'll continue on the other side
Sure.
of news, traffic, and sports.
Fantastic. Yeah, so Ahmad, we have, like I mentioned, client-centered, strength-based approaches. We have a team that represents the community in which they serve, and so having that peer-led, peer-navigated approach adds a great deal of value. We have a number of partners that specialize and focus in some of these communities, specifically as it relates to women's needs, transgender needs, youth needs, and so having this community-based approach to care and services, and really looking at, again, how are we putting folks in the front of their care and needs, but then also centering the data in a way that allows us to move forward.
Okay, you did that really quickly. We still have a minute left.
Oh, great.
And I think sometimes when we're in these spaces, the community-based organizations and leadership, we look at things in terms of, it's a data-based approach or it's a client-centered, but it doesn't always resonate to a regular person
Sure.
listening. Like, what does that really mean? If I'm unhoused or I'm struggling with addiction, right?
Mm-hmm.
Or mental health issues, maybe, anxiety, depression, whatever. How would I get help from Ahmad?
Sure. So connect with our team, through the website or a phone call or a walk-in, and we have a team that is ready to receive folks and assess them and connect with them at their basic set of needs. And so your folks are coming in and in need of recovery support or food insecurity or safety. Our team looks at those needs right away, connects to build what we call a care plan, looking at all of those necessary components, be it housing, be it recovery support, be it mental health support, and building a roadmap of sorts on how we're addressing these needs in a particular order, to not only address those immediate needs, but to build a care plan that looks at retention and sustainability.
amaad.org. Continuing the conversation after news, traffic, and sports right here, KBLA Talk 1580.
More of First Things First with Dominique DePrimo when we come forward.